Good evening guys. In this lecture we will be discussing occlusal relationships. We classify occlusion on the basis of first permanent molar relationship, and that was the concept given by Edward Engel. Most commonly we consider that Class 1 molar relationship is the normal occlusion and we call it neutral occlusion. Class 1 molar relationship means the maxillary first molar is slightly posterior to the mandibular first molar, the mesiobuccal cusp of the maxillary first molar is directly in line with the buccal groove of the permanent mandibular first molar, and facial profile is termed mesognathic. Just like this. But we just automatically assume that each and everything would be fine when there is molar class 1 relationship. We don't explain that there will be incisal class 1, there should be incisal class 1 and canine class 1. Well, in actuality or in reality, in most of the cases it does not occur. When there is molar class 1 relationship, there are chances that there would be some crowding, there would be some spacing, rotations of the teeth, or there could be bimaxillary protrusion, or there would be some excessive overjet or overbite. So that is why we call it class 1 malocclusion. Only and only class 1 or normal occlusion is when there are no spaces, when there are no rotations, when there is no crowding, the overjet and overbite is normal. Incisal relationship class 1, canine relationship class 1, in addition to the molar class 1 relationship, and the skeletal relationship is also class 1. Now what happens in normal occlusion and how different teeth they occlude? The maxillary mesiolingual cusps, where they are occluding. Mesiolingual cusp of any maxillary molar will be in relationship with the central fossa of the corresponding mandibular molar. This is the mesiolingual cusp of maxillary molar. This is another mesiolingual cusp of the maxillary second molar. So they are articulating in the central fossa of the mandibular molars, in the corresponding central fossa of the corresponding mandibular molar. If we look at the facial surface of mandibular molars, only mandibular first molar, it has two facial grooves. The first groove is mesiofacial, which is between mesiofacial cusp and the distofacial cusp, and the second one is distofacial, which is between the distofacial cusp and the distal cusp. Other molars, they have just one groove. The mandibular second and third molars, they have just one facial groove. Maxillary mesiofacial cusps. Maxillary mesiofacial cusps. And Edward Engel actually classified malocclusions on the relationship of maxillary mesiofacial cusps with the facial grooves of mandibular teeth. The mesiofacial cusp of maxillary first molar, it will lie in the facial, that mesiofacial groove of mandibular first molar. Similarly, mesiofacial cusps of second and third maxillary molar, they will also lie in facial groove of corresponding mandibular molars. We can see second over here, the third one is not present in this set, but here we can see the third one. In this slide we will be discussing about the distofacial maxillary cusps. Distofacial cusps of first maxillary molar, it will lie in distofacial groove of mandibular first molar here. And distofacial cusp of second maxillary molar will lie in the facial embrasure of second and third mandibular molar. Third molar, if it is present, the maxillary one, if it is present, it will be only in contact with the lower third molar. It is the only maxillary tooth which has a relationship to the single tooth in opposing arch. Well, if third molars are missing, upper and lower both, then second molar maxillary will be the tooth which will be having relationship with the single opposing tooth. Distolingual maxillary cusps. Distolingual maxillary cusps. Distolingual cusps of first maxillary molar will lie on the distal marginal ridge of first mandibular molar and mesial marginal ridge of second mandibular molar. And similarly, it will be for the distolingual maxillary cusps. Distolingual cusps of first maxillary molar, they will lie on the distal marginal ridge of first mandibular molar and mesial marginal ridge of second mandibular molar, and it is similar for the second maxillary molar. We can see it over here, the distolingual cusp of the maxillary first molar. It will lie on the distal marginal ridge of the first mandibular molar and mesial marginal ridge of the second mandibular molar. Similar for the second maxillary molar, if third is present, then it will be in relationship to the distal marginal ridge of lower second and mesial marginal of the lower third molars. Distofacial mandibular cusp. We can see the distofacial cusp. These are over here. We can see the reds. These red marks, they are representing the distofacial mandibular cusps. Distofacial cusp of any mandibular molar will lie in the central fossa of the corresponding maxillary tooth. We can see it over here. This is the distofacial cusp of first permanent molar, and it is the central fossa of the maxillary first permanent molar. Similarly, this is the distofacial cusp of the lower second molar, and this is the central fossa of the maxillary second molar. Similarly, you can see even the third one over here. Mesiofacial mandibular cusps. Mesiofacial cusps of the first mandibular molar will lie on the mesial marginal ridge of maxillary first molar and distal marginal ridge of the second maxillary premolar. So over here we can see the mesiofacial cusp. It is in relationship to the mesial marginal ridge of the first permanent molar and the distal marginal ridge of the second premolar. Similarly, we can see the mesiofacial cusp of second mandibular molar. It is in relationship with the mesial marginal ridge of second molar and distal marginal ridge of the first permanent molar. Now, let's see the lingual mandibular cusps. Mesiolingual cusp of first mandibular molar. Over here, this is from the. These are cut models and they are colored so that things will be easily understood. Mesiolingual cusp of first mandibular molar will lie in the lingual embrasure of first maxillary molar and second maxillary premolar. This is the second premolar, and this is the first permanent molar, and this is the lingual embrasure. This is the mesiolingual cusp of the first permanent molar, so it is between these two teeth an embrasure is formed and it is lying over there. Similarly, if we see the mesiolingual cusp of the second permanent mandibular molar, it is lying in the lingual embrasure made by the second maxillary molar and the first permanent molar, the distal surface of the first permanent molar and the mesial side surface of the mesial cusp of the maxillary first molar. Distolingual cusp of the first mandibular molar will lie in the lingual groove of first maxillary molar. Lingual groove. There is always a groove over here, the lingual groove, and the distolingual cusp will be lying just in the lingual groove of the maxillary first permanent molar. Similarly, the distolingual cusp of the lower second molar, or if third molar is present, they will also be lying in the lingual groove of the corresponding maxillary molars. Now, maxillary premolars. This is the mesial surface, this is the distal surface. First maxillary premolar buccal cusp, it lies in the facial embrasure of first and second mandibular premolar. This is the first mandibular premolar, the second would be over here, and this is the maxillary first premolar. So the mesial incline of the upper first premolar, they will be distal to the distal incline of the lower first premolar, and distal incline of the upper first premolar will be mesial to the mesial incline of the lower second premolar. The lingual cusp of both maxillary premolars, they lie on the distal marginal ridge of the corresponding mandibular premolar. This is the mesial view and that is the distal side. So the lingual cusp, they are resting on the distal marginal ridge of the corresponding mandibular premolar. Even we can see it over here, there it will be true for that as well. Here we can see from the lingual side, and we can see the lingual cusps, they are resting on the distal marginal ridge of corresponding premolars. The upper premolars, their lingual cusps, they are resting on the distal marginal ridges of the corresponding premolars. Canine relationship. In a class 1 relationship, the mesial inclines of the maxillary canine, it will be distal to the distal incline of the mandibular canine, and the distal incline of the maxillary canine will be mesial to the mesial canine of first premolar. Lower central incisor and upper central incisor. Now, mandibular central incisor is the only mandibular tooth which comes in contact with a single tooth, and that is maxillary central incisor. Lateral incisor, it comes in contact mesially with the central incisor and distally with the maxillary lateral incisor. If we see the upper incisors in horizontal and vertical relationship, there should be 2 to 3 millimeter of overlap. There should be just a 2 millimeter to 3 millimeter of overjet and 2 to 3 millimeter of overbite. That is the ideal relationship, and we know that upper incisors are slightly in positive inclination labiolingually. If we remember the 6 keys of occlusion which were given by Andrews, one of the keys was about the labiolingual inclination. This is the famous Picket and fence diagram. If you remember this Picket and fence diagram, then easily you will be remembering each and every single tooth's corresponding relationships, and you will be able to reproduce it whenever you will be asked. So this Picket and fence diagram is quite important. Now, eccentric mandibular movements. Any movement of the mandible away from the centric occlusal position that results in tooth contact, it is called as eccentric movement. It could be protrusive, it could be laterotrusive and mediotrusive and retrusive. Laterotrusive will be on the working side, whereas mediotrusive will be on the non-working side. Protrusive mandibular movements. There is contact anteriorly in disocclusion or disclusion. Posteriorly, anterior guiding planes for this movement are mandibular incisors move against lingual force of maxillary incisors and incisal edge. Keep in mind, in natural dentition, when incisors they come in contact, posterior teeth are separated. But we don't want this type of arrangement in complete dentures. If this will happen in complete dentures, then upper and lower dentures they will dislodge, the Christensen phenomena. Posterior guiding planes, mandibular centric cusps, they pass anteriorly across the occlusal surfaces of maxillary teeth without contact, they just pass across them. Posterior protrusive contacts, they occur on the distal inclines of maxillary, lingual cusps and mesial inclines of opposing fossae and marginal ridges. They can also occur between the mesial inclines of mandibular buccal cusps and the distal inclines of the maxillary opposing fossae and marginal ridges. So over here we can see protrusive mandibular movement for anterior and posterior teeth. In anterior, the incisal edges of lower anterior teeth, they will just be guided by the lingual fossae of the upper anterior teeth. They will come in contact and they will move forward to come in an edge-to-edge position. Whereas in posterior, the mesial inclines of lower, they will move against the distal inclines of upper. The mesial of lower, they move against the distal of upper. Now, anterior teeth in laterotrusive and protrusive. Anterior teeth, they play an important guiding role during left and right mandibular movement. In a normal occlusal relationship, maxillary and mandibular canines, they contact during right and left lateral movements, and so have laterotrusive contacts, which occur between the labial surfaces and incisal edges of mandibular canines. This is known as canine protected occlusion. Anterior teeth might come in contact during laterotrusive movement or might not, depending on the height of canines. So clinical crown length of the canines, it determines whether the incisors they will come in contact or not. So over here, if we see a canine guided occlusion or canine protected occlusion, then we can see that these are the upper anterior teeth, these are the lower anterior teeth. These blue spots, these are the centric stops, and then these are the protrusive path. We can see that central incisor and lateral incisor, they come in contact with maxillary central incisor during protrusion. And when they come in contact, so these are these yellow lines where they come in contact. And when there will be laterotrusive movement, then these green lines on the left or right laterotrusive on the canines in canine guided occlusion. We know that laterotrusive movement could be of two types, either canine guided, like over here where canines are in contact on the working side and rest of the dentition is in disclusion. Either it would be on the right hand side or on the left hand side. Or there will be group function where on the working side all the posterior teeth they will be on contact and rest of the dentition will be discluded. Here we can see a left molar. We are just taking this example in left laterotrusive movement. So left side in our this case is working side. What is happening on the left molar? There will be contact in two contact areas. One between the inner inclines of the maxillary facial, this is the facial side, this is the lingual side. So one is in the inner inclines or lingual inclines of the maxillary facial cusps and the outer inclines or buccal inclines of the lower buccal cusps. And second will be on the lingual inclines or the outer inclines of maxillary lingual cusp and facial inclines or inner incline of the lower lingual cusp. We call these contacts as laterotrusive contact or working side contact. Now when this will be the working side, now let's see what would be happening on the balancing side, that is the right hand side. On right hand side, what is going to happen? There will be only one point contact. The contact will be occurring on left lateral movement, the right molar. The contacts are between the inner inclines of maxillary lingual cusp and the inner inclines of mandibular buccal cusp. We also say that facial incline or buccal incline of maxillary lingual cusp and lingual incline of buccal mandibular cusp. These are known as non-working side movement or non-working contacts. So we can see over here again that these laterotrusive and mediotrusive or Bennett movement, they were actually, we call them Bennett movement, because Norman Godfrey Bennett was the first person who studied these movements, and he told us about the working side and non-working side movements. Now what we have studied in our previous slide, we can see that there are 2-point contact on the laterotrusive side or on the working side and 1-point contact on the mediotrusive side or non-working side. Retrotrusive or retrusive movement. It is the opposite of protrusive movement. The mandible moves more towards the distal. The mandibular buccal cusps, they move distal along the occlusal surface of opposing maxillary teeth. In the maxillary arch, retrotrusive contacts, they occur between the mesial inclines of the lingual cusp and the distal inclines of opposing fossae and marginal ridges. We can see that over here, maxillary mesial inclines, they cross the mandibular distal inclines. Now it is totally opposite. In protrusive, there were mesial mandibular inclines and they were passing in relationship to the distal maxillary inclines. But here they are mesial mandibular inclines, distal mandibular inclines and mesial maxillary inclines. So over here we are done with this lecture on occlusal relationships, and hopefully things will be quite clear to you now. Any questions, you can always message me and you can always ask me. Thank you very much.